This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. Finding out the Affordable Care Act isn't so affordable that you can't keep your doctor or you have to pay an annual fee just to be a member of a practice? That preventive care really means take this pill for the rest of your life? I'm Dr. Tom Roselle, and one day I will show you how to take control of your health and avoid a lifetime of drugs and probable surgeries. Join me for Ageless Health 2014, a day that will change your life forever. For details and registration, visit agelesshealth2014.com or call 703-698-7117.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. Give me a call, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied, you've done the same old, stuff that doesn't work. Well, here's an opportunity to really find out what does work, and particularly in today's presentation, we're going to be talking about pain and pain management. So how many of you are putting up with and dealing with pain on a day-to-day basis, thinking that, you've got to live with it the rest of your life, or it'll go away, or, I can handle this, or if I don't do this, it's not so bad, or, and you keep losing the quality and in some situations the quantity of your life, and you said you're always walking around with a bottle of something, some kind of non-steroidal anti-inflammatory or some very significant drug, Percocet or Advil, that has been laced with other things, and oxycodone, and which are combination drugs. These things are deadly. They're things that will destroy your liver, destroy your kidneys, increase the potential of heart failure and strokes. And you're doing that to fight pain when there's another way of doing it, of reversing it, of turning it around, and eliminating it perhaps forever. In studio today, someone that you all are very familiar with, an expert in the area that we're going to be talking about. And what are we talking about? We're talking about acupuncture and pain control, or pain management. And my guest, your host this Wednesday evening, the 10th of the month at 7:30 p.m. at Roselle Center for Healing, Dr. Stephanie Pina. Dr. Pina, Dr. Stephanie, hi.
Hi. Good afternoon.
Good afternoon. It is. Hey, listen, it's fall outside finally.
I know, it feels like it too. It feels good.
Yeah, you have a sweater on, and I'm noticing.
That's because the indoor temperature doesn't match the outdoor temperature.
It's because it's cold in here, and Jeff's got the air blowing around, and trying to move the bugs out of here and so forth. He told me everybody's sick, but I don't believe that.
That's a whole different show.
That's
right?
a different show. We'll do that another day. But we're talking about acupuncture today and pain. So if you've suffered with pain, regardless of the type of pain, whether it's the pain of metastatic cancer, whether it's pain of a disc problem in your neck, or you got migraine headaches or whatever, this is the subject that we're talking about. Dr. Stephanie, there's a whole area now that is just about that. It's being studied by National Institute of Health. It's all over the place, and the double-blind studies are very impressive. They say simply it works. Talk about it a little bit. Give us a little background.
Well, it's interesting. I want to say in the last 5 to 10 years, there's been more and more research on acupuncture in this particular field versus acupuncture, using it for other modalities such as, sleep and hormone function. But pain management, is something that a lot of people come in for. It's the top thing that we see patients come in for at our clinic for acupuncture, and a lot of doctors are kind of running into an area where they just can't prescribe the right drug, or they can't treat the patient, so they're still kind of dealing with chronic pain. So what's interesting is you're seeing more people going, we've heard about acupuncture, how does it work, what is it doing in the body, what types of things can it actually treat? So more and more research and nationally funded research is coming out on trying to address those issues. How does it work on the body specifically, and what areas does it work the best in?
Well, it goes back to the point that it works, and it's a phenomenal application. At one point, it was one of these things that was just observed. You did this, and something happened. But the patterning that is demonstrable, that is researchable, if you want to use that word, that is very documentable, is specific. And we can go back where it actually entered in this country in the 70s, about 1978. Richard Nixon opened up the doors for communication between the United States and the East. And then, we saw that, if I remember, Nanking University in China and cooperative study with the National Institute of Health and all of that. I mean, this is becoming a front-line application. What kind of, in your experience, and you've had a great broad-based experiential base, in your experience, is acupuncture one of those things that is just a threshold response type of I'm going to get very specific.
I know where you're going.
Yeah, you know where I'm going.
I think I know where you're going.
Yes, yes.
I think I can take it.
Okay. So, yeah, I'm trying to be nice, but I can't. There's no way of being nice. Okay. So, is acupuncture just one of those things you put a needle in someplace and stimulate an area, and because it causes a faster response to the brain and overrides the brain, or is there much more to it than that?
There is much more to that, and I think the increase in that research shows that, because every time they try to prove that it works and they're showing that it is work, they'll see how one person responds to it and another person doesn't. You know why? Because everyone has pain that's different, and their body is obviously what's the mechanism that you have to treat. You just can't treat the symptoms itself. Otherwise, the things like medications where we know we can just shut down the pain response and not feel anything, that's where that comes in. But acupuncture doesn't work that way. We know that it can affect blood flow. We know it can affect oxygen flow. We know that it can affect inflammation, getting it away from a damaged tissue, and it can affect function of an organ. So when you're dealing with pain management, all those come into place, never mind, looking at the other things that we always talk about on the show, what's going on with the digestive tract, what's going on in the immune system. All those things can slow down that healing response as well, too. And that's what's not being taken into consideration when you're looking at research.
Research is an amazing situation. You can construct it and manipulate it to tell you what you want it to tell you. And that's where you get some of the naysayers about, acupuncture. But what you just touched upon is so important. You take two different people. You take someone who is in a lot of pain and who has that pain because of trauma, because of injury, because of a disc that they ruptured in their spine, degenerative disease, stenosis. And you take somebody who has pain because of just chronic wear and tear and breakdown over time. Now, you have two different models. One where this person may be, the one that we talked about first, might have a very decent lifestyle and diet, and the other one may have a degraded lifestyle, so it's wear and tear and degeneration from, let's use the term, unknown sources, right? Mm-hmm. So one responds very rapidly to stimulation of the energetic fields, acupuncture, and one gets some help but doesn't respond as rapidly. Why?
Well, you have to look at those outside factors for sure. And we're all different. I mean, I think that goes even down to our preferences on what we like to eat just in general or what we like to do. We're all different. We respond differently. So when you're using acupuncture, the great thing is that you can change your treatments based off of those different responses in the patient. You can actually go in because there's no select protocol for someone who has, say, migraine headaches versus someone who has tension headaches. And when you're looking at what you use acupuncture for, you're treating the person in front of you. You're treating those different individuals. So the person that you do have to do lifestyle changes with can get just as much benefit out of using acupuncture and needles and herbs and chiropractic manipulation as the person that's coming in and they look like they have the healthy diet, but they're just not responding at the same time.
This Wednesday evening, the 10th of the month, September 10th already, Dr. Pina will be your host, your presenter, and she's going to be talking about pain control utilizing acupuncture points, both with needle acupuncture and without needle acupuncture. There's many different sources. When we talk about meridian therapy, probably better said than acupuncture, what you're doing is you're stimulating the energetic pathways, you're balancing the pathways, you're increasing the substance, if you will, to allow the body to do what it was designed to do by its creator, and that's heal the way it's supposed to heal. This Wednesday evening, we'd love to have you as our guest. Give us a call, 703-698-7117. That's 703-698-7117. Roselle Center for Healing is located in Fairfax, right on Route 50 in the Red Cross building. We're about a quarter of a mile plus 100 feet or 100 yards or so off the National Capital Beltway. Easy to find. It's still lovely outside. Be our guest. Dr. Stephanie will be there to answer your questions after the presentation as well, so you can get very intimate with your problems. Give us a call at 703-698-7117. When it comes to understanding acupuncture, I'm going to put a question out there real quick, because a lot of people listening, and you've seen so many of our patients say, well, I don't want to do acupuncture because there's no basis for it. There's no justification. Or even worse, they tell you that it's mysticism. It's negative spiritualism. It's from the East. This big cloud cloak of being something from Eastern mystic something or other. How do you respond to that?
Well, I hear it a lot. Everything from its, evil sources to, even there's a diagnosis in Chinese medicine called evil wind pathogens, and that's what causes the common cold. So we had to kind of say, okay, let's break this down. Obviously, talking with an acupuncturist who knows what they're doing and can explain things in medical terms is the greatest benefit for any patient, because they have to be able to explain it out. There's a lot of tradition that comes in any kind of medicine that's been around for 3,000 to 5,000 years old, and the medical terms that we use now and how we explain things are very different than what they explained before. I used to say it's like Greek and Roman mythology. How did lightning come around? Well, Zeus came around and made the lightning bolt.
That's right.
We've kind of moved on from that. So even some of the concepts where we talk about chi and the energetics and stuff, there's modern day physiologic basics for it. And when we talk to patients we want them to understand that it's not simply we're putting the needle in, and that's my tool. Just like the tool that you use for chiropractic manipulation would be your hand. You're using that to direct a change, make a change physically in the body. So a lot of times it comes down to answering those questions on a one-on-one basis, because different people have different perceptions on what's going on. The main question I always get asked is, is it going to hurt? It's because everyone thinks back to the last time they had a blood draw or they got an injection. So that even pain technique is very different. It's a different response than what we use with the acupuncture needles themselves. In fact, you can fit about 10 acupuncture needles in what they do a blood draw with.
Well, Connie would tell you that the pain threshold in acupuncture would be dependent on whether or not you or her do it opposed to my needling.
Can I say I agree? I'm just saying I've heard feedback.
Only because you guys are chicken and you use the very, very gentle needles. I use the ones that are traditionally trained in China.
So basically now you are bringing all the acupuncture patients over in my direction.
That's right. I'm trying hard. 888-630-9625. If you'd like to join us this Wednesday evening, 703-698-7117. Dr. Stephanie Pina will be your presenter. Dr. Stephanie is not only a traditionally trained acupuncturist, but she's also a doctor of naturopathic medicine. And if you really want to understand things both from an Eastern and Western perspective, but also from the basis of natural therapeutics, this is a presentation you really need to be present for. She's amazing. I'd love to listen to her talk. We go back and forth in the rooms outside of patients, and I can always get a little bit of tidbit. And I've been at this thing 38 years, and she's definitely able to teach me a few things. Dr. Stephanie, trace the process. Why is NIH suddenly becoming very interested in the subject of acupuncture? And what are the primary applications? Is it pain?
Pain tends to be the number one thing that they tend to focus on, because I think that's what most people want to find out about. That's also whether or not they're going to their doctors, they're complaining a lot about pain. So they don't have the examples that people are sick of the drugs and the medications. So what they're really trying to do is find an alternative source or something that can be used with their current medications and stuff to basically, treat their pains. When you look at the World Health Organization's list on what acupuncture covers, a lot of them are pain-based. So they're starting with that, and they're building off of that list as well.
It's amazing to me. I started using acupuncture many years ago. I was trained in school, and then obviously hundreds of hours in addition to that afterwards. Amazing application. And when I use the things that I know and add that piece to it, the healing process is so exponential that you sit back there and say, wow, that was the missing link. This Wednesday evening, Dr. Stephanie Pina, your host, your presenter at the Roselle Center for Healing. Call us at 703-698-7117 and tell my staff that you'd like to be there. Remember, these are free to you. We just require a reservation. We'll be right back. You're listening to Dr. Tom Roselle Live. Ageless Health and Wellness is your birthright, but for so many of you, it's an idea that's meant for someone else. Perhaps this is too familiar. Your energy is low, you suffer with health problems that just don't seem to go away, and even progress to something worse. Ask yourself right now, do you deserve a better life? This is Dr. Tom Roselle. You've heard me on Dr. Tom Roselle Live Sundays at 12 noon, but on October 18th, I invite you to join me live and a group of experts in health and wellness for Ageless Health 2014. Proven tools to maximize your health at the Fairview Park Marriott Hotel in Falls Church. Registration is only $99 for a full day of health education and interactive learning. Register for 2 and save. Seating is limited. Call today for details to register at 703-698-7117. That's 703-698-7117. Or visit online at agelesshealth2014.com. That's agelesshealth2014.com.
105.9 FM and AM 630, Washington's Mall, WMAL, where Washington comes to talk.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio. Give us a call, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject. Listen, if you're suffering from chronic pain patterns, no matter what they are, this is a topic that we're discussing today that you really need to consider at length, because if you don't, you're missing part of the puzzle. Most of you who have been in the practice understand that when we look at a condition, we look at it multidimensionally. We look at it from a neurological point of view, an energetic point of view, a biochemical point of view, and we try to figure out what is the best match to give the patient the greatest ability, potential, if you will, to turning things around. Acupuncture, energetics, dealing with that energy system is critical in maximizing other things. I can tell you that nutrition and spinal manipulation are part of the pieces, cranial release patterns, reflex patterns, all the things that we use in functional medicine protocols. But if you don't have the energy pathways behind it, you are not going to maximize the results that you need to get. Acupuncture is part of mainstream medicine at this point. The Center for Complementary and Alternative Medicine recently released that something in the neighborhood, Dr. Stephanie, 5 to 10 million Americans are using acupuncture-like applications. And not only are they using it as an independent standalone procedure, which is phenomenal. You know that it's used for all kinds of things, including one of your specialties, and that's fertilization, fertility types of conditions, and amazing, but particularly for pain control.
Yeah, you're seeing more people have access to it too, and there's more and more information. The great thing about the NIH studies is that it's also starting to break the barriers of as far as that translation. You know, what's this crazy mystical stuff from the East all about, and how do we apply it in modern day techniques? Because some of the times we think, well, do we even have to go in if we're sick? And acupuncture can work even if you're healthy, even if you're trying to prevent disease. One of the things, too, that's interesting is some of these studies are also looking at and kind of coming up to par with the idea of what a research study is in pain control. And for patients, that's a good thing because that's what gets reported. You know, you hear the news on what's the latest and greatest thing that happens, and then all of a sudden you don't hear any more about the details behind that. Well, acupuncture studies are starting to get into what's the difference between simply inserting a needle and actually inserting in the correct position. What's the difference between what they call sham acupuncture, where you may be kind of using the placebo effect and nothing's really happening and it's all in the mind of the person to treat the pain, versus an actual needling treatment from someone who's like trained.
Dry needling, and opposed to what you do and what I do in the office.
Very controversial subject with acupuncture. All I'll say is, acupuncture works. I'm going to keep it nice for right now. The good thing is that in both situations, when the needle's inserted, there's a physiological response. And that's what makes the change in the body. It's affecting the nervous system. It's affecting the circulatory system. It's doing numerous effects on the body, whether or not you have a specific effect or not. But the insertion of a needle in the body basically does that. So you can change the name of the treatment to whatever you want, but both practitioners are basically doing the exact same thing. The way that they explain it and the way it's explained to the patient and how it works, you can go from there.
Well, years ago there was a theory and application of something called Melzack gate wall pain control theory. And basically it's a stimulation of the neurological receptors it reaches the brain first faster than the low chronic threshold of pain. So it interrupts the pain cycle. Subsequently, the neurology of the body acts in a way to modulate the pain. And that's, in my application, in my perception, that's what dry needling does opposed to traditional acupuncture, where traditional acupuncture has a way of balancing the system so the body actually can do something it's supposed to do that's called healing.
Yes.
And it not only gets rid of the pain, you can get rid of pain with acupuncture very quickly. I drive my dentist crazy because I'll put needles in my hands, small ones, right in the webs of my hands. I'll go in, I'll sit in his reception area for about 10 minutes, and then I go in, and he can do anything he wants to, and I don't feel anything. And, he looks at me and he said, please, can I give you? I said, no, I don't feel anything. Why should you give me anything? I think he wants to do it because he's afraid. Mm-hmm. But the truth of it is, I've seen on closed circuit television today, monitors that open heart surgery and all kinds of things are done with the placement of about 7 or 8 needles, and the patient is wide awake talking to them, but the patient doesn't feel anything. It's dealing with the way the body handles neurologically pain thresholds. This is a phenomenal application. When I was in China 2 years ago, I saw things there dealing with pain that were just mind-boggling, plus other things. We're going to get into this. We have some callers that are starting to light up, and we're going to take your calls, but don't go away. When we come back, I also want to talk to you a little bit about Ageless Health 2014, October the 18th, Saturday, a day you don't want to miss if you really want to take control of your life, your health, and those are the ones you love. This is a day that can change your life forever, and I truly mean that. If you take the concepts that we're going to give you, you can turn almost anything around. Don't go away. You're listening to Dr. Tom Roselle. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Finding out the Affordable Care Act isn't so affordable that you can't keep your doctor or you have to pay an annual fee just to be a member of a practice? That preventive care really means take this pill for the rest of your life? I'm Dr. Tom Roselle, and one day I will show you how to take control of your health and avoid a lifetime of drugs and probable surgeries. Join me for Ageless Health 2014, a day that will change your life forever. For details and registration, visit agelesshealth2014.com or call 703-698-7117.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. If you're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's 888-630-9625. What a beautiful day outside. It's a fall day, finally. The heat, at least temporarily, is no longer with us. Well, it's still nice. I mean, if we thought about this heat in the springtime, we would say it's warm outside. It's 70-some degrees, and it's lovely. And we had the top down, and we were able to, and I asked you, is it too cold for you? And you said no. We were very nice.
Perfect.
I had my toy.
Yep.
Yes, I had my toy. I get to put the top down.
So did everybody else on the highway.
Yes, they did. That was actually, everybody was out. It was amazing to me. Want to remind everybody, Ageless Health 2014 coming up. When is it coming up? It's October the 18th, and it's going to be at the Fairview Park Marriott Hotel in Falls Church, Virginia. It's a day that will change everything that you think about healthcare. You're ready really to take control of your own life. Are you, you're ready to create a greater wellness potential, in your system? Get 2 or 3 people. You're going to save some money. And join us. Dr. Stephanie will be there. I'm going to be there. My doctor's going to present. Sue will be there talking to you about pieces of nutrition. We have different levels of registration. Go to rosellecare.com. That's ROSELLECARE.com. And check it out. You can still save some money. Pre-registration is still open until September the 15th. After that, the price goes to $99, which is really cheap anyway, considering what you're going to get. I mean, you get to go home with all the material. We're going to give it to you all. You'll have a cheat sheet that you can sit there and follow the presentations, but we're going to give you all the presentations. We're going to enter you in a drawing for $1,000 worth of health care. You've got to be there at the end to win. And we're going to receive a lunch that is organic and that you can enjoy while you're sitting there listening to everybody. There's going to be a gift bag. There's going to be notes. There's going to be, and it depends on the levels that you want to check out. But go to agelesshealth2014.com or go to rosellecare.com and check that out. Meanwhile, we're talking to you about pain patterns. So if you're suffering from any kind of chronic pain, this is an opportunity for you to really get it together this Wednesday evening, September the 10th, and listen to Dr. Pina talk about management of pain with acupuncture, and not only management, but resolution. Let's go to the phones. Jean, thank you for being patient. How can we help you?
Yeah, I wonder if you can help me. I have problems with my wrist, my hand, my arm. And the diagnosis which I was given was, it's findings compatible with tear of the CAPHOLUNATE ligament bilaterally.
So they're telling you that you've torn the ligament supporting your wrist, and what are they? Can you be more specific as far as when this started? How did it come about?
Well, actually, the wrist looks a little swollen, and I don't know. I had fallen, but I started having the pains. I'm just thinking to myself, maybe I hurt my wrist when I fell, but I don't know for sure.
You fell down, so you braced yourself with your wrists. You could have very well hurt yourself. And see, the wrist is an interesting mechanism. You have 8 little bones that are in the wrist area. That allows you to move your wrist and turn it and right. Extend it and so forth. And you've got 2 bones in the lower portion of your arms that go into the wrist, called the radius and the ulna. And then you've got this huge ligament that goes around it and supports these bones and holds things together. Now, you have muscles and so forth. If you fell and you jammed your hands, then you're going to end up with what's called a carpal tunnel type of problem. It doesn't have to be the carpal tunnel itself, but it can be an entrapment of any of those nerves. The ligaments are going to be irritated, and it's going to cause swelling, and it's going to cause pain. And if those nerves are screaming, then you're not going to be able to lift anything or grab anything or deal with it. Yeah. Dr. Stephanie, weigh in on this thing.
Well, I think I've had it now over a year, and it's just getting worse.
Yeah, because it's not being treated properly.
Well, it's not being treated at all.
Well, Jane, it should be treated. Dr. Stephanie?
Well, what's amazing is you even notice, too, when you're saying, it's this injury looks like it started in the wrist itself, but you're kind of noticing it up to the elbow and through the arm, too, is because right now that inflammation that's trapped in that area, your body's trying to heal it. It's affecting the other parts of the body, too. So it's not even just treating the wrist, it's treating the rest of the body so that it can heal. Acupuncture locally in that area, and even looking at how the surrounding muscles and bones are actually kind of, if they've been jarred, if they've been tight, that's going to prevent blood flow and circulation from getting down in there so it can do its job. And the longer it doesn't go treated, the more we can either get things like scar tissue build up in there, we lose loss of function in that area. So then it becomes not only difficult to move the area because there might be swelling in there, but now we're losing function because the body's just kind of placing down its best ability to heal, and it can't function anymore.
And even my fingers, I've got terrible pains in my fingers.
Yep, so it's before, it's, at that level, and then, on either directions of it. And in Chinese medicine, it's similar to the idea when we talk about pain, we talk about blockage of qi or blockage of circulation, and the pain area can be like a dam in a river. If there's no water on one side of that river, there's an issue. If there's no water, if there's backup water on the other side, there's an issue. So pain's not only treatable right at the source, you have to look at where else in the body it is, and sometimes it's not just in one area. You have to treat the whole area.
Gene, just like the nerves start in one place and go to someplace else, you could have a problem with your hands if your neck was irritated because the nerves that make your hands move start in your neck.
Well, my neck also, I have pains in my neck also that go up into my head.
So it makes total sense. I mean, when you fell, you could have irritated your neck. You could have had a whipping action that took place. It can be very, very extensive. So it's one of those things. Join us. You're in Arlington. Come to the presentation Wednesday night. Let Dr. Stephanie talk to you for a few minutes. We'd love to have you as our guest. We'd love to explore this a little further for you. Lawrence, how can we help you, sir? Thank you for calling.
I was having my thyroid checked a few times, and the doctor says my numbers has been high. I had it checked about 3 times, and it's been like 12, 10.
Which chemistry is he looking at? Now, is he looking at TSH? Is he looking at T4? Is he looking at T3? Is he looking at reverse T3? Do you know which one it is?
Not really. I'm not really.
Okay, so it makes a difference. I'm going to make a huge assumption that he's talking about thyroid-stimulating hormone, which is TSH, and we don't know for a fact that's what it is. Normal laboratory levels for TSH are somewhere in the neighborhood of 0.578 all the way up to about 4.5. Normal, what we call functional medicine normal, are 1.8 to about 2.2, maximum about 2.3. So if you're at a 12, you're way over the threshold, which would indicate an inflammatory reaction, potentially maybe something called a Hashimoto's thyroiditis, which is an inflammatory autoimmune condition that comes about from all kinds of things, allergy reactions and so forth. But you'd have to know everything about it. When you do it, if you really want to understand thyroid, you've got to do TSH, free T3, free T4, total T3, total T4, reverse T3, T3 uptake, and then you have to do TPOs, which are the thyroid antibodies. That's just a start. That's when you can really understand where it's coming from, because the active hormone, if you will, the one that works for thyroid, is something called T3, and T3 is converted from T4 primarily in the liver, with a little bit of conversion taking place in the kidney. Dr. Stephanie, you want to jump in on this thing a little bit?
Sure, and the amazing thing is a lot of the doctors out there don't tend to do that many lab testing as well, too, on the thyroid. They tend to stick to the TSH and maybe T4 if they've already given out medications. So a lot of times people don't have that basic information to kind of see what's going on, and is it simply happening? Is there an issue simply at the thyroid level? Is it from the hypothalamus, which is basically kind of like the thyroid level on-off switch? Or is it happening in the body where it's not converting? And that might have to deal with more, how your nutrition is. Do you get the trace minerals that can activate that? So when you're looking at thyroid issues, there's so much more to look into.
Lawrence, one of the things that we see with somebody who has an elevated TSH, and again, we're guessing because you don't know which one it is their allergic reactions to different foods. One of the main culprits is gluten, and it's because so much gluten today has been modified because of Monsanto. You have about over 10 to 15 times as much gluten in a substance today as you did many, many years ago, and the grains are not the same. We talk about modern grains opposed to ancient grains, and which are sustaining and which are not. But the point of it is that they cause a huge inflammatory response. I'd love to be able to help you. Give us a call. Come by our office and talk to any of the doctors, or give us a shout out on email at rosellecare.com. That's ROSELLECARE. Love to talk to you on that. I appreciate your phone call. Bernice, how are you today, kiddo?
Oh, fine. I have a question about my dad. He has, about 4 years ago, he had enlarged prostate, and they went in and they did something to where they shrunk it. I think it's surgery. And lately, about a month ago or 3 weeks ago, he urinated some blood, and they did some testing. They said his prostate is enlarged again. And I wanted to know, they said that there's a lesion on the prostate, and they want to go in and do a biopsy. So which way should we go? And give me some ideas here of how, should that biopsy be taken? Should he do it, or are there other options?
Bernice, anytime that they want to do a biopsy, whether it's a prostate biopsy or whether it's a breast biopsy, if it is a cancer of any sort whatsoever, you run the risk of causing a metastasis to take place, because you're going in and you're breaking the capsule. So, for example, in prostate, it can be encapsulated, means self-contained. In the breast tissue, it can be encapsulated, self-contained. And if you go in and you put a needle into that capsule, now you rupture the capsule and you pull the cancer cells out with you, and it ends up in other pieces of the breast tissue or the prostate tissue. So unless there's diagnostics that tell me that it is much more invasive, meaning that it's not an encapsulated type of situation, my recommendation is you need to talk to several people. But if it was me, if it was my own body and so forth, I wouldn't be doing that. There's things that called cyberknife, and it's very, very localized radiation if they know that it's cancer. How can they distinguish it? Not only through ultrasound, but also MRI. And that will tell you if it's there. There's blood tests that will tell you if it's metastasized. So you need to find someone who really understands it. The American Cancer Hospitals, and it's the reason that I recommend them as one of many different recommendations for cancers, is that they do an approach of both integrative and traditional treatments, and you can call them as 1-800-4-FOR-HELP, H-E-L-P. There's a lot of things out there that that you can do far beyond having them go in and cut things or do biopsies or even radiation.
And will thermography identify anything?
No, not in prostate. In breast tissue, what it'll show is that if the area is inflamed, and so it shows that there's something that's going on. Thermographic imaging shows heat, and it shows blood flow. And so with heat, if there's inflammation, it's going to show it. So in the inguinal area, in the groin area, it'll show things that are very hot, and it'll give you a predisposition. It'll show the neck. It'll show the breast tissue. It'll show the armpits. It'll show the immune points on the skin surface. It'll show reflex areas that are there. So what you have to remember about thermographic imaging is that it does not show mass. It shows the inflammatory levels, or it shows the blood supply. Why is that important? Because before you can have a tumor, you have to have a blood supply. And in many cases with malignancies, you have to get the blood supply going anywhere from 3 to 8 years prior to the mass showing up. So you have the opportunity to be able to do something about it.
The other interesting thing, too, is, even if we're not even looking at whether or not the prostate may be cancerous, is we have to rule out other issues that may be causing the enlargement as well, because essentially blood in the urine is not the only kind of thing that goes on with prostate cancer. Genetics and looking at family history as well could be very interesting to see, is there already a genetic influence for enlargement of the prostate? What else is going on as far as inflammation to that area? Just the whole, the kidneys are involved, the reproductive tract is involved. There can be a lot of different things. So even inflammatory reactions from infections can be involved. So like urinary tract infections can cause issues. So there's a lot of other things that need to be kind of diagnosed before, going in and doing major surgery, making sure that the person's in the best possible health, whether or not they have to go into surgery, or doing things like the CyberKnife, which is amazing because when I was in school, CyberKnife was only used for brain cancers. And so now they've been able to kind of change them around and use it in other areas of the body. And then places like Cancer Treatment Centers of America that Dr. Roselle mentions has acupuncturists and naturopaths on staff that know how to use, alternative and also holistic types of medicine along with any kind of conventional medicine too, to get really the best for the patient as well.
Bernice, there's so much more out there, and you really need to do some homework. Give me a note on our website at rosellecare.com, and I will give you some direction. But if that was me, and I hope I never have to make that decision, there's nobody that's going to do that intervention to my body, because I know what takes place. I will do other things first to try to get things under control. There's a level now where even the traditional community, the traditional medical community, is saying their guidelines are if patient does not have enough years to meet the average lifespan, they don't even treat anymore when it comes to prostate cancer. So the average lifespan for a man is in the 70s. So if your father's in his 70s or late 60s and they project that he doesn't have at least another 10 or 15 years, the standard of care now is that they won't even treat him. Or shouldn't treat them. They may. You're going to have doctors who will treat anybody for anything at any time. But the point of it is that the body has the capacity to change virtually anything. Bernice.
He's not bleeding anymore. I think my sister's on the other line right now. She's listening. I think he bled like 4 days ago, but he's not bleeding anymore like he was in the beginning.
Bernice, let me know if I can help you in any way. I really appreciate it. 888-630-9625. That's 888-630-9625. Join us this Wednesday evening, the 10th. September. Dr. Stephanie Pina will be your host, your presenter at the Roselle Center for Healing. She's going to be talking about pain control and acupuncture and how all that works and why it needs to be a total application of multidimensional, utilization. Be there. We'd love to have you. All you got to do is call 703-698-7117, 703-698-7117. Tell my staff that you need a reservation. By the way, they don't cost you anything. It's just that we want to know that you're there. We'll be right back. You're listening to Dr. Tom Roselle Live.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
WMAL-FM Woodbridge, Washington. WMAL Washington. WRQX HD2, where Washington comes to talk.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. You can find us here every Sunday, same old place on your dial at 12 noon, bringing you the most intimate and updated information on integrative and alternative therapies through the use of acupuncture, chiropractic, nutrition, and all those other things that are out there that you didn't know anything about. We do, and we try to get you that data as best that we possibly can. This Wednesday evening, Dr. Stephanie Pina will be your host, your presenter at the Roselle Center for Healing in Fairfax, Virginia. And we're about a quarter of a mile off the National Capital Beltway, and we're right in the Red Cross building. Easy to find. Promise you that this is blockbuster information. We'd love to have you as our guest. We're going to take one more call, but we're going to have to limit it. Betsy. Hi, Betsy.
Hi, Dr. Roselle. I'd like to thank you for taking my call.
You're welcome, hon. We've got about a minute, so I want to...
A couple of years ago, I was diagnosed with Hashimoto, and I've had two different doctors, my medical family doctor, and then he had sent me to one of those hormonal specialists. I'm not sure how you say the name, endocrine or whatever. She says they both would like to have me on hormone or thyroid replacement, and she would like to have me on Synthroid, and I wanted to do things more natural, so I've been staying off of it completely, and they're not happy about that. So my family doctor said he would let me have Armour, but the woman doctor says that that would not be a good thing for Hashimoto patients, but I don't want to be on something that I'd have to depend on for the rest of my life.
Okay, Betsy, the first thing that you have to do, and I'm going to make this very quickly, and I want you to send me a note at rosellcare.com, and we'll talk about this a little further because I've got to end this, but the thing of it is Hashimoto's is an inflammatory reaction to the thyroid due to an immune suppression reaction. So the whole idea is not to replace something. The whole idea is to shut the immune reaction down and decrease the inflammatory irritation. Now, and I'm going to just give you a mantra, if you're eating anything that has sugar, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, you want to go as organic as you can and get rid of the gluten, and you'll find that things will be much better. Give me a call or send me a note, and actually that's the fastest way of getting to me. Dr. Pina, we've got about a minute. Let's talk about why people should show up this Wednesday evening.
Well, we're going to talk a lot about pain management and the use of acupuncture, more the modern-day researchers, and how do you understand what the heck that's going on with acupuncture. We're going to go over different types of pain and how the body responds to it as far as increased inflammation, the response of pain and stress, even motions and moods, how that can affect your healing from different types of pain management things. And non-needling techniques as well, too, because we get a lot of questions about what can you do as well as at home and in the office as well.
That's the important part, is understanding that acupuncture, when we think about it, we think about needles, but that's not the only way of stimulating the immune points, and you can be there this Wednesday evening and find out. We'll see you next week. Same old time, same old place. Promise you a much more interesting program because Dr. Pina is going to be at the microphone. See you then. Bye. Finding out the Affordable Care Act isn't so affordable that you can't keep your doctor or you have to pay an annual fee just to be a member of a practice? That preventive care really means take this pill for the rest of your life? I'm Dr. Tom Roselle, and one day I will show you how to take control of your health and avoid a lifetime of drugs and probable surgeries. Join me for Ageless Health 2014, a day that will change your life forever. For details and registration, visit agelesshealth2014.com or call 703-698-7117. This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com.